Hello, my name is Dr. Augustine from Ahead to Wellness, and today we're doing a testimonial with Lorraine. Lorraine she's been coming in to see me for quite some time now, and we're going to kind of talk to her about her story. We started seeing you when? How long ago was it?
Well, 3 years ago. 4 years ago, I was diagnosed with a very rare autoimmune disease, pemphigus vulgaris. Maybe 1 in a million had it. And I first was put on prednisone for a month or so, then they put me on more medication. And then finally an infusion came along, and I did that the following year. Supposed to reduce it, maybe send it into remission, but it didn't happen. And so then my brother said, you have to go see Dr. Augustine. And that's when I came here and met with you.
God bless your brother. He's such
Yes,
a great guy.
he is great. And then we did the body scan. That's how it began. And then he put me on a lot of vitamins because of the results. And we did more testing, and then you found the reason for the autoimmune disease. Even though they say the immune system attacks itself, it was attacking something, the gut bugs. That's what we found. And you said when the gut bugs go away, so will the autoimmune disease. Then he put me on the medication, and one of the items was paracetamol. And it was doing a lot of good because it felt like it was doing something. It was not the most comfortable vitamin, but it went, I think we did it for a few months. And then one day we retested, it was gone, and so was my autoimmune disease. And I'll never forget what you said to me that first day. When we sat down, you said, Lorraine, I can shrink tumors. Do you really think I can't help you? So thank you.
Well, another question though, what kind of symptoms did this problem create for you?
That autoimmune disease was lesions. It presents in two ways. One is all over the skin. Mine was lesions all over the inside of my mouth and throat.
Oh, that's awful.
Very painful, and I couldn't eat.
Yeah.
And if it got worse, I would have had to be fed intravenously. It was that bad. I was told by a specialist that 40% of her patients would probably go into remission a little longer. 60% would come back. And mine was not going into remission. It was just a little less when I came to see you.
Yeah.
But it was painful, and I was eating practically nothing. It was that bad.
Foundationally to most autoimmune diseases is fixing and solving gut problems, and when a person has autoimmune, we're also wanting to see if they have any, we call it gut bugs or bugs, bad bugs in their gut that are autoimmune triggering bugs. So if we can get rid of those bad guys and then heal and seal up the gut lining, hence people also typically will have leaky gut that have autoimmune disease. So we heal and seal the gut lining, that's when the problem starts to shut down and normalize. The immune system starts to normalize and stop attacking, in this case, her throat and mouth and all those tissues. So she's done really super well. What else did we do? We did Biocranial.
Biocranial, the cell exercise, putting oxygen into my cells, massive doses of vitamins.
Yeah.
And that was it for, I think, the better part of a year, I think.
And I think I kept bugging you about reducing your stress, staying away from stress.
Yes, yeah.
That's kind of a good thing.
Yeah. So other than my drive here on the freeway.
Which
that
was
worked,
huge.
That
Where do you live? How many hours away?
I live about an hour and a half away.
Yeah.
And so, yeah, that took a while.
So for whatever crazy reason, you thought it was worth it to come
I
all the way
did.
here.
I did.
Yeah.
And my brother believed in Dr. Augustine so much that he threatened me that if I didn't go on my own, he would come get me and bring me here. And so thank you to both of you,
Nice.
you and my brother.
He's a good guy.
But the treatments were incredible. And it's interesting when you start feeling the result, and it started to feel less harsh.
Yeah. Getting rid of gut bugs is not very fun initially.
No.
But we try to minimize that, and as far as you knowing that that's what's expected and it's okay, and you're going to come out the other side being great.
Yes. So I knew what to expect. I knew it would not be smooth, and that meant it was working. And to this day, if I tell medical doctors about it, that Dr. Augustine got rid of it, they'll say, no, that's not true. It's in remission. You can't fight an autoimmune disease. And so I can't say anything.
If Lorraine had brain damage and did exactly the same things that caused it in the first place, she ate bad food, she had massive stress, she wasn't getting sleep, she put a bunch of bad bugs back into her gut and destroyed her gut lining, probably from eating a bunch of wheat products that have gluten that can destroy your gut lining. Yeah, you could move back into it, but
I didn't.
You wouldn't, and you wouldn't
No.
want to do that. Why would you
No.
want to do that? So,
Right. It was also the different types of nutrition I should be looking at, and I was careful, and I have been ever since.
yeah. So lifestyle is a
Yes.
critical part of this. If you don't
Yes.
change your lifestyle and the reasons that caused it in the first place, of course the problems will never go away. Or you can recreate it. So
Yeah.
we've learned, right? We've
Yes.
learned.
We
to do
didn't
those
bring
bad
it
things.
back. It's gone. So, yeah.
So then most recently you had a bout of high blood pressure.
Yes.
And
Went to a doctor, and 2 trainees were there and said, we're going to put you on medication, just like that. And they prescribed it. I bought it, and it's still sitting in the house unopened. And I thought, let me call Dr. Augustine. So I called you and again said, we have a new thing to deal with. And then we talked about that, and I was given vitamins to help with that. And then we started the program of the Biocranial again, and the cell exercise.
yeah.
Because I hadn't been in a while because of the distance. And then I came back and started a regular routine again with Dr. Augustine, and my blood pressure came down
Tremendously.
tremendously, and now it's within normal range again.
Interesting point, though. You know, it sounds like we do biocranial and cell exercise and vitamins with everybody.
Yes.
And there's a reason for that. The actual doctor healer in the body is the brain, so we want to do biocranial to let the brain do its job to heal the body. Then what is different with each patient is the nutrients, the supplements that we give, because in Lorraine's case, we wanted to support her liver a lot. She had liver issues, but it could be different. It could be someone could have allergy and immune problems in that sense that can increase blood pressure. Or they could have too much stress on another side, and we need to support their adrenals. So the nutrients will change, but nutrients are the tools and fuels to repair and heal the body. Right?
Right.
What does the healing, what does something with those is really your brain. And then the cell exercise is absolutely magical and amazing. It charges up the cells, puts energy back in the cells so that the cells can actually take in the nutrients, and then everything starts to function normally.
And it just, everything is wide open. Then the vitamins go in and it's fully absorbed. That's always
Yeah.
been my belief.
Exactly.
And yeah,
And you're proving it.
yes, yeah.
And so then the most recent thing, that's why you're coming in here today, is to have a
Yes.
chat about what?
Cholesterol.
Okay.
And so again, the doctor was talking about medication, and I thought, I have to go to Dr. Augustine and talk about cholesterol.
Statin drugs will definitely lower your cholesterol.
Yeah.
But it's treating the symptoms as opposed to, let's ask the question, why is the cholesterol high in the first place? Get to the root cause behind that. So what could that be? Certainly one thing, and I'm not putting this on you and saying that you're doing this, but certainly people can eat too much carbohydrates. Starch and sugar beat up your liver, or alcohol beats up your liver and raises your cholesterol levels. Another reason can be your immune system can be very active, maybe challenging a bug, or it could be, in your case, allergic response.
Yeah.
If you have a lot of allergies, well, your body sends out cholesterol to go calm down the inflammation going on in your body. So it can be that. Those are some reasons, and so that's the stuff that we should probably
Yeah.
chat about more.
Yeah.
Figure that out.
Plus, on medication, that's a whole new set of side effects that I don't want. That's the other thing. Even if it brings it down, it's causing more problems. So anytime I can avoid that, I'd rather do it here and treat it naturally.
In the process that we do, people that are on medication say, hey, well, when can I stop the medication? So I'll say, well, how about this? If we are not treating cholesterol, because we don't treat, cure, or heal anything, we actually solve the root cause that's causing the symptom of higher cholesterol. So if we never actually have to do that, we can actually go to the root cause, then the problem resolves on its own, your cholesterol starts dropping, then the medication naturally can go away. Your doctors say, well, your cholesterol's fine.
Yeah.
Of course, they would say it's because of the medication,
Yeah.
but we do that a lot with blood pressure. Blood pressure is dropping. If you take the blood pressure medication and it's already low or normal, it's going to go too low. Then you're going to be tired and dizzy, and so people will not need medication when they solve the root cause of the problem. So that's the thing that we'll be working on to figure out now.
Right. Yeah.
So one of the initial supplements and the things that we discovered were intestinal parasites, and hence the word, and the supplement that we used was parastanil, strange name, parastanil, helps to get rid of your bad intestinal parasites. So that's one level of taking some bad bugs down, which I think that was the priority at the time. Then we moved to, I laugh at this one, it's called GI
Oh, yes.
GI what? Synergy? GI
Yeah.
Synergy. What's in there? 3 capsules in each packet, and you ramp the packets up progressively over time. And you do it slowly so that you don't have much of a reaction against these bad gut bugs dying off. At some point, you'll hit a point where you go, oh gosh, it's giving you a tummy ache, or you have some diarrhea, or something of that sort. As soon as you run into that, you back down by 1 packet, and you stay there for a couple of days at like maybe 2 packets. And then you slowly ramp up, and the goal is to get you to 6 packets a day of GI Synergy. And then when you have no symptoms, you're at 6 packets a day, and you've completely finished them. Gut bugs are probably a good thing.
Yes.
They're bye-bye.
Yeah, and you feel the war going on. You do feel it. The soldiers are in there fighting.
And see, speaking of that, that's the other thing, is you've got to put in the good guys, right? The other
get
soldiers.
rid of the bad guys.
Which would be called probiotics.
Yeah.
At the same time, we want to heal up and seal the gut lining with a glutathione powder that's really soothing and helps the lining of your small intestine to heal up nicely. Exactly what you did.
Yeah. Yeah, it was really something. And just the most wonderful feeling when you feel it subsiding and you know that, okay, it's changing. Something's changing in there. And then it's gone.
What was the most difficult thing, do you think, in this process of dealing with this?
I think the most difficult was the drive getting here.
Yeah. We would talk a lot about stress, right?
Yeah.
Like, oh my goodness, right.
No, the most difficult was the war in there. When I started taking that paracetamol, it was affecting me, and I knew that was what it was supposed to do, but it was so uncomfortable. But that was what I needed to go through to beat it.
And see, that's a good point, because you and I had a lot of conversation about what you can expect.
Yeah.
Because classically, people will take medication, they'll have side effects. Well, this wasn't a side effect of taking medication. This was die off of these bad bugs, and people should expect that and actually welcome it, believe it or not, but it's because you're getting rid of those bad guys.
Yeah, and you prepared me for that.
Yeah, and so then it was a little better, a little better.
I've come in with different problems, and then I start getting treated, and I think at this point I realize it's better to just come in often enough to maintain it, not just to bring a problem, but I think maintenance is good too.
Right.
To
See,
keep the cells going.
That's not the mindset of most people today, because we've been brainwashed to you go to the doctor when there's a problem, and then once the symptoms of that problem go away, you're fine. But you only go there.
Yeah.
And I like to describe that as like, if you want to, this is Walt Disney, if you want to keep your windows clean, when should you wash them? Well, when they're clean, actually. Yeah. So maintenance and improving your health and wellness is a completely different mindset, and that's what you have now. So this is my patient, Lorraine. We just did a testimonial about her autoimmune condition, really rare, but she got rid of it. I say she because we've worked at this together, right?
Yes.
I couldn't do this without you.
It was a partnership.
Yes. So that's Lorraine's story today. If you like what you hear, I'm on social media. I'm also on YouTube, I'm on TikTok, I'm on Facebook, and also on Instagram. And again, my name is Dr. Augustine. Have a great day.